Shelly Denes. I'm a physical therapist and I do some speaking for PESI. So today I've been asked to talk a little bit about fall prevention since it's a fall prevention awareness day. So I do a certification course for fall prevention specialists, and there you can see the registration there if you're interested in it, either live or webinar, or you can buy it. And there's quite a bit of stuff. So I'm just going to try and hit on a couple key things that I think are kind of important, a little out of the box for fall prevention and fall risk. The first thing I'm going to mention is that CDC has an initiative called STEADI, STEADI, which stands for Stop Elderly Accidents, Death, and Injury. If you go to their website, and it's really easy to find. It's very user-friendly for patients, for clients, but also for clinicians. And I use quite a bit of stuff from there in my talks about fall prevention or decreasing fall risk. So there's quite a bit of stuff. So it entails an algorithm that includes a lot of things that are out of the box, different than just balance and gait, which are very important. But this is what we always think about when we think about falls. But there are a lot of other things, including medications. There's a ton of medications that clients can be on, especially the elderly population, that can have some potential risks. And I'm not saying that you should tell your clients to stop taking them. Just be aware that if they're on 4 or more medications, I'm talking about not vitamins or over-the-counter stuff, like hypertensives, anticholinergics, stuff for digestion, stuff for cardiac disease, stuff for diabetes. If they're on 4 of them or more, chances are some of these may be potentially a risk for a fall. So what I would suggest is, number one, you should be aware of the medications that they're on, look them up. And if you see that the accumulation of these has a potential for fall risk, bring it to the attention of the client or the patient or your family member. Discuss it. And then from there, maybe we need to have you make sure you should be aware of the medications. Number one, you should be learning them. And then it should be brought, maybe it needs to be brought to the PCP, the primary care physician, maybe to the nurse practitioner or PA in the office. All of these can make a huge difference in fall risk. Studies have shown that if you make one intervention to help fall risk, it can be astronomically important and have a big effect. So just imagine if you do a fall risk assessment and you find 2 or 3 things that they need, it's going to be potentially much, much better. Okay. The third thing I'm going to bring up is sleep. Okay. It's very important for all of us from birth to the end of life that you need sleep. Sleep is where our memories where our memories are consolidated. It rests the brain. It also helps just with homeostasis. People who have sleep deprivation, even for 1 night, 2 nights, can have a potential imperative impact on their balance. Okay. So it's very important that you look at or ask your clients or your family members or yourself, are you sleeping? And are you sleeping well? Are you sleeping in the dark? It's important that there's darkness at night. And if a client or you or your family member or your grandmother or your great aunt have to get up in the middle of the night, there should be a motion sensor light that goes on only with motion so that they can walk to the bathroom with light and not have a potential for a fall. Now, the other thing is a motion sensor light, let's say that's on the toilet, which has been really cool, and it lights up in all kinds of lights, colors. You can put that under the bed so that when they first sit up, they move their feet, that turns on the light. So that's a really cool, very inexpensive way to do a motion sensor light, because you don't want light on all night. You really don't get what's called REM sleep, rapid eye movement sleep, or deep sleep, if there's not darkness. Okay, very important. even important for kids. The other thing is it's important that they sleep at night and they're up during the day. So, should they nap? Well, maybe they need to nap a little bit so that they sleep at night. But an older person that takes a lot of naps during the day and then up at night, that's not going to be good for just circadian rhythms. You know about circadian rhythms. That's the rhythm of your body at your particular your place. For example, I'm living Eastern Daylight Time. People who live in Central Time or Pacific Time, their circadian rhythm will be different, okay, than yours. So when you travel to their location, your circadian rhythm is going to be altered a little bit. You should take that into consideration. If you've ever had jet lag, you know what I'm talking about, okay? The other key thing is in the morning, the thing that sets us off to be active is light, sunlight. Then the light, you need light. It's important in the morning not to wear sunglasses, okay? Be exposed to the light. That minimizes the amount of melatonin that we sleep with, okay? Activates our body, that we are active and we can move well. That's going to be much, much better for decreasing our fall risk. I would give you a perfect example. You go, if you do any home care or you know older people, you go to their apartment or to their home or to their room in a place. It's dark. The blinds are closed. They got their glare lights on. It's 11 o'clock in the morning. No wonder they're not moving well. They're in a dark space, okay? They have not stimulated the light to get their body going into the new circadian rhythm. The way that our body starts in the morning and increases us to have activity and be up and ready is cortisol, which is the stress hormone. That minimizes the amount of melatonin, okay? You also get serotonin, which is the happy chemical that will be stimulated by activity and being up during the day, okay? Then as the day goes on, we decrease the lighting, okay? Later in the day, stop using cell phones and computers with the blue light. Let's say 3 o'clock, 4 o'clock, 5 o'clock, 6 o'clock, depends on the client, all right? Caffeine. Caffeine also isn't good usually at the end of the day, towards the latter part of the day. It's good in the morning because it helps wake you up. So we want to be active. We want to stimulate our clients to be doing well. All right. The next thing I would mention, number 4, would be vision. Okay. If someone's vision is impaired, what's that going to do for fall risk? It's pretty obvious. What if their glasses are dirty? That might be the first place to start. If you see older people, their glasses are filthy very often. Just clean their glasses. They don't know because they haven't been paying attention. And over time, it's gotten dust and stuff. Clean the glasses. The other thing with vision would be multifocal lenses. Okay. If any of you have ever had bifocals, or you know somebody that has, the first time you put on a bifocal, you try to go up and down stairs, it's a little weird because the lower part is blurry because it's for reading. So you have to get used to where you do move your head with bifocals in order to go up and down steps. So if you have an older patient that's using bifocals or trifocals, take them outside or take them on the stairs. Let them practice using a bifocal or a multifocal lens. And if that isn't working well, then maybe they need to use a distance lens for walking and a reading glass for reading. Now, again, we have to take into consideration cognition. Can they handle 2 pair of glasses? Can they handle 1 pair of glasses? It's a specific thing for every specific patient to figure out what works for that. And the other thing I would bring up in terms of vision is the coordination of vision with the ears, okay, and with balance, okay, with proprioception. So there's a thing called VOR, vestibular ocular reflex. In the few minutes that we have today, we can't go over that very much, but I do speak about it a lot in my course if you're interested, and also you can Google it. It's very, very important to make sure that your client or you yourself have that coordinated. Vision should be coordinated with your ears and with the vestibular system and with proprioception in your feet. and in your legs. So VOR, or vestibular ocular reflex exercises, either sitting, standing, or walking in that progression, super easy and very good. And guess what? All of us can use it because we all can improve our balance. Even if we're 25 and we're a marathon runner, we could still be better. And it's something that we can certainly put some attention to. So that's another thing that would be very important. So you can Google that and find out quite a bit about that. The next thing I would talk about in terms of fall risk would be vitamin D deficiency. Okay, there's been a lot of studies that have shown clients that have vitamin D deficiency tend to have more falls. And it's not necessarily a direct correlation. It ends up the clients that have vitamin D deficiency tend to be less nutritiously appropriate. And unfortunately, one of the things that has been found that if you put an older person, let's say that they broke their hip and you put them on vitamin D, it doesn't seem to increase tremendously. It's something that needs to be addressed earlier in life, so that we need to make sure that everybody, all adults, all kids, have appropriate vitamin D. Number one, for osteoporosis, but it also impacts on a lot of other things. And there has been some research that has shown that vitamin D deficiency has a correlation with diseases like Parkinson's, multiple sclerosis. And this is some of the research that has come to the forefront recently in terms of that. So you might like to see some of that. So vitamin D is very important. So early on, we need to make sure our patients are getting enough vitamin D. The amount is usually 1,000 IUs, or the international value. But I would say if your client does have vitamin D deficiency, or if you look at their labs and you see that, they need to go to their primary care physician or primary care provider, and they should make the determination as to how much vitamin D they may need as extra. They can do it in their diet, or they may take it as a supplement. Okay, but again, have to see how that correlates with their medications and things like that as well. And the last thing that I'm going to mention is shoes. Okay, appropriate shoes. Okay, I'm not saying they have to go out and buy expensive shoes. Shoes should be flexible. Shoes for walking, standing, doing activities, for the most part, should have a flexible sole. This is fairly new in the research arena. If you go and buy a running shoe now compared to 10 years ago, it's going to be a lot more flexible. Whether it's Adidas or New Balance or whatever company, they're more flexible. And the reason this is because they have found it's a little, the neuromuscular component of movement is much more appropriate for the lower extremities, especially the knees. Okay, it's just a little bit more like real natural movement, and yet they're in a shoe. This started with the running barefoot, but then they found running barefoot wasn't the greatest. But we did pick up from that a flexible sole is a good thing for the most part. Your clients should be in shoes that fit, that have a back. Okay, it also puts compression on the foot, which helps with edema. It helps with pain. It also increases sensation in the foot and in the legs, in the feet, like proprioception. Okay, so the compression is a good thing because it increases sensation, it decreases edema, it increases tone to the lower extremities. So it's good for people that, let's say have orthostatic hypotension or problems with their blood pressure lower. So the last thing I could mention would be orthostatic hypotension, where the client sits up, they get a little dizzy, okay, especially, and then they have to run to the toilet. So we need to address that in terms of how their blood pressure is going. That may be from too many medications for hypertension. That might be that they actually have what they call orthostatic hypotension. That might be that maybe we need to address that they don't have urinary incontinence, and that we have them make sure that they're not having to go to the bathroom in the middle of the night. Maybe it depends is appropriate. Maybe a something else like a urinal, which doesn't work for women so much, but works for men. So those would be the key things that I would talk about. Again, as a as a final moment or a final note, I would say go to the CDC Steady STADI website because they have a ton of stuff and videos, posters, PDFs, research, videos that are excellent and are updated on a probably a daily basis. So that would be quite the thing that would be very important. So if there's any questions, I'd be more than happy and be willing to answer those or try. Um, thank you for the time. Let's really look at Fall Prevention Awareness Day as a forefront for helping everybody because falls is something we really want to avoid. Thank you.